signage.
For you, man, would you like to change?
It's, it says Medicare health plan expert. So I know I kind of just talked about it quietly over here about who I am and what I do. So I'm a Medicare carrier. I get paid the exact same amount. That is a rule that is put in place by the Center for Medicare and Medicaid Services, which is CMS. They govern all of this stuff. They govern how Medicare works for you guys as well as it does for us agents and brokers. And so that is a set limit, and that way we're not trying to put you in something that's going to work out well better for Mike. It needs to work out best for you. So that's kind of the situation there. So it's better when you are working with an agent that they're not going to make more by putting you in a bucket. So let's turn the page. So we're on to the initial enrollment period. So your initial enrollment period is a 7-month window around your birthday. So what that means is you can sign up for Medicare up to 3 months prior to your birth month, and up to 3 months after. If you sign up prior to your birthday, it will go into effect that birth month. So if you're born in April and you signed up in January, it's going to go into effect in April when you turn 65. And then you have a few months after in case you missed the boat or you just wanted to delay it, wait it out a little bit, and sign up after. So on top of this, there are other election periods once you are already on Medicare. So you have your annual enrollment period, which is October 15th through December 7th. That is every year. And that gives everybody that is on Medicare a chance to make a change. So whether you're on original Medicare with a supplement, or a Medicare Advantage plan, you have the opportunity to make a change. There's also another one that we're actually currently in, and it's not advertised, not like you see on TV during the fall, but this time of year it's called the open enrollment period, which is January through March. And if you are specifically on a Medicare Advantage plan, you can. Are you folks here for Medicare somewhere? Yep. Yeah, you can turn this thing out. You had that full 7 months. Yeah, but, and I'll talk about the late enrollment penalty because that's a very common question. I hear there's this penalty. Well, we're almost there. And because we are going to talk about it. It's very important to know how that works. But again, the election period we're in right now is open enrollment period. So if you do have a Medicare Advantage plan, it gives you a chance to make a change. So maybe you made a change in the fall, and now you got cold feet and you want to go back to the plan you were in, you can do that now. Or you whiffed and totally forgot or didn't see that annual enrollment period just happened, and all of a sudden you went to the doctor or you got your prescriptions and they went way up, and you're like, Mike, what happened? Well, your plan changed and you didn't change the plan, so you had an opportunity. So there's other election periods that are known as special election periods, and what those are, life happens. So let's say you move. That opens a special election period, and you have 60 days to choose a new plan. Other things, divorce, things like that. But there's a whole slew of different election periods. So if something changes in your health, or something changes in your life, you can always look to make a change in your Medicare. It's always something possible. All right, so let's turn the page. How you can join Medicare. So, at the top of the page, when you are turning 65, if you are already collecting Social Security, they will enroll you in Medicare automatically. So, come on in. Come on in for the Medicare summary. Yeah, come on in. Traffic. It says you have A and B, and it starts on your birth month. Real easy in that case. But let's say you're either still working or you're not collecting. As long as if you're not collecting Social Security, you have to. And down here at the bottom, it explains to you the 3 options you have to do that. You can go online at ssa.gov. That's a pretty efficient way to do it because you can track it. You create your own portal there, and once you're collecting Social Security, you'll be creating the portal on there anyways. you can contact Social Security with the phone number there. That should actually be all the way down here at the bottom, because that's the last thing you wanna do, and then, you know, with the cuts with folks out there, there's gonna be less people to answer the phone, to be honest with you. And then, the other option is to apply at your local, Social Security office. And again, that's
So it's just-
gonna be tougher.
so it's just three things.
Offices. So, if you are short on time, go to the office. You know, if it's a couple weeks away and you need to make sure this happens, you want to talk to someone directly. You got a few months, you're in good shape. I was reading other things about that, but that's for another time. I'm seeing that more today. But, so turn the page to, now we're on to original Medicare. So on this page is Part A of original Medicare. That is your inpatient hospital, hospice, inpatient physical therapy, which is skilled nursing. And then down below, it shows you a little pay scale. Now, first things first, Part A is free. As long as you have worked for 10 years or 40 quarters, so basically pay taxes for 10 years. It doesn't have to be consecutive, that's why they have it as 40 quarters, but over your lifetime. If you're at, yes ma'am.
So, what I'm hearing you say that if you work for 10 years in any industry, you can get Part A free.
Yes. Yep. As long as it was, yeah, here in the United States and you pay taxes.
Really?
Taxes. Yep.
Free?
Yeah, Part A is free.
Wow.
Part A, just the inpatient.
Is that the one that's required, mandatory?
Yeah, so A and B are required, and I'll talk about.
Oh,
that
I'm sorry, I'm
next. Yep.
getting before.
Yep, no problem. But thing to note down here, in this little pay scale, it says what you paid, mine says 20, oh yeah, I think yours should all say 2025. Everything on here should say 2025. I had printed out a few of these earlier in January, and I forgot to change a few 2024s to 2025. Everything on here should say 2025, just in case you were, I think I have them that I'm using. One thing to note on, you know, the biggest thing to note on here is the deductible. On original Medicare Part A, that $1,676 per benefit period, that is not a yearly deductible, that is per admittance to the hospital. So if you've come out of the hospital and you've been out of the hospital for 60 consecutive days, and then get readmitted, let's say for the same thing, you have that same deductible. So, one thing I'm gonna talk about combined here with Part A and Part B of original Medicare, there's no maximum out of pocket with original Medicare. So if you are not on a supplement or you're not on a Medicare Advantage plan, there's no cap to what can come out of your pocket. So with that, let's turn the page to Part B, and I'll reiterate that point again at the end of that. So original Medicare Part B. This part is your medical part. So this is your doctors, x-rays, labs, etc., you know, outpatient surgeries. This comes at a cost this year of $185 per month. When we turn the next page, you'll see that there is actually a sliding scale based on your income. So if you make above a certain amount, that could be a little bit different. But the base is $185 for most folks. And so down here in the little matrix, the pay matrix, it talks about the deductible down there. Now that is a yearly deductible. That $257 is a yearly medical deductible. And then the next row just really tells you what this plan is. So original Medicare Part B is an 80-20. Medicare pays 80%, you pay 20%. Now this is where that important part in that part is that I brought up before, which is there is no cap on this. So, you know, the example I like to give is, let's say you go in for a hip replacement or a knee replacement, some outpatient surgery. You're going to be responsible for 20% of the cost of that. So, not trying to scare you, just inform you. That's original Medicare. A and B are original Medicare. So let's turn the page. So here on this Part B monthly premium, so I talked a little more in depth on the $185. And really, this is just a tax bracket here. They call it IRMA, income-related monthly adjustment amount. And you can take a look at that and you can see if you're making income. And, you know, that could be, you know, whether it's from a job or it's assets, things like that, any kind of income. But anyways, you can take a look at that. And then down there at the bottom, on the left, what's the Part B late enrollment penalty? You know, is there, you know, I always like to phrase it, is there a Part B late enrollment penalty? So there's two answers to it. It's yes and no. So let's go with the no part of it first. So let's say you turn 65, you're gonna continue working. So let's say you're gonna, whatever age you're gonna work, let's say you're gonna work to 67, and you have employer group health currently. And as long as there are at least 20 people on that employer group health, they say that that is what's known as creditable to Medicare. You're for Medicare seminar? Come on in. Everything. If you have employer group health, and there's at least 20 folks on that employer group health, it's what's known as creditable to Medicare, which means that coverage is good, and you can defer Medicare. Really, what it gives you is an option. So you could actually, you could go with Medicare or you can stay on your employer group health. But if you're good with your employer group health, you can defer Medicare, and by deferring it, you don't have to do anything. You don't have to call anybody, you don't have to send in anything in the mail. There's nothing you have to do. And then, when you get ready to retire, there's a couple forms you fill out, and typically your HR departments have them, or I have them as well. And they're very simple one-page forms that says, you worked at this company from this date to this date, you had the employer group health from this date to this date, and you send that in when you go to apply for your Medicare Part A. So that's the working part. So, when there is a penalty, so let's say you turn 65, you retire, but you say, well, I know my Part A is free, so I'm just gonna take that. So we're just gonna assume we take that. But I don't wanna pay that $185 a month. I'm healthy. I don't need the medical part of this right now. I wanna save that money. So for every year that you do not take Part B, there's a 10% penalty per year. So let's say you wait till you're 67 to take your Part B. So there would be a 20% penalty on top of that $185 per month, and that would be for life. That's the part.
That's a lot.
You are retired, and you say you know Part B. That's the Part B. Everybody clear on that?
You got your A and B?
Okay. So, the gentleman here was saying he's retired. Oh, you're not retired yet? Okay, you're taking your employer group health currently? Yeah, then you're good until you're ready. Yep.
What if you're on the spouse's health plan?
Great question. Yes, you can join. So let's say you retire, but your spouse has great health insurance. Or even if they're older than you, but they have employer group health. Yes, you can go on their health insurance and defer Medicare that way. And again, when the spouse goes to retire, then you both are filling out the form for the Part B. Yep. All right, let's turn the page. So, with Part B, there is no prescription drug coverage that is given to you by the government. So Part A and Medicare. Part D is prescription drug coverage, and this is provided by private insurance. So all those different insurers I talked about earlier, many of them have standalone prescription drug plans. They are all tiered and set up very similarly. They're structured very similar. What changes about them are premiums, deductibles, and then within their tiers, so they have typically 5 tiers where they go. Tier 1 is preferred generic all the way down to specialty drugs. I think it's more expensive as you go down. It's whether they have co-pays versus co-insurances in given tiers, and then where they place specific drugs. So really thinking about the brand name drugs, the newer drugs, is where they tier those in there can make a big difference in what you would pay. So another thing here, so on Part D, there's also a late enrollment penalty, and Part D goes 1% per month. And then they have a number in there, is $36.78. Well, that is what they call the national average. There is, it's not that all prescription D plans premiums are $36.76. It's just a number they use to assess that penalty. That's all that number was used. Another thing to note up here at the top right, and this is a change this year, so for any folks in here that are currently on Medicare, I don't know if anyone is, one thing that changed is there's now a maximum out-of-pocket of $2,000. So before this, I'm not gonna confuse everyone, but it was different. That's all I can tell you. Anyone here?
Y'all better not retire. Do not retire. Yeah. Yeah, goodness. Y'all better work so
One of the other changes they made this
the
year
employer can pay you insurance.
is you can go on a Part D payment plan with your carrier.
Payment
So
plan.
any carrier, you have to do it. So let's say you go to the pharmacy in January, and it's, I'm gonna use a real easy number to work with here. Let's say it's $1,200. Now, you know you're only gonna spend another $800 the rest of the year, but for this month of January, it's $1,200. You can't afford that, you know, it's crazy.
You better stay working.
What you can do,
You better stay
if
working.
you haven't already, you call your carrier and you say, hey, I'd like to get on the, prescription drug payment plan. Take them 3, 4, 5 minutes, okay, you're good to go. Then you go up to the counter and get your prescription drugs, you don't pay them anything, and then your insurance carrier will bill you monthly, and then you spread it out over the year. So for $1,200 in January, makes it real easy for my math, so it's $100 a month. This is Medicare Part D Extra Help. So it's also known as LIS, Low Income Subsidy. So if you make, your income is below a certain level, you can apply for low income subsidy, extra help through the government, and that will actually help pay for prescription drugs. So pay for premiums on plan and the prescription drugs themselves. There's a few different levels of it.
Yeah, that's over here.
If anybody in here thinks
Thank
they
you.
may qualify for that, I actually have a nice email I put together with cutouts and directions on exactly how to use the website. It's actually pretty simple. And again, Part D is the very bottom right. There is an income-related monthly adjustment amount, and that is based off of that 3678. So, but it's the same exact bracket that was on Part B monthly premium. So the bracket looks the same, and then I just put the first few dollar amounts in there. So let's turn the page. So it talks a little bit more about Part D and how it works. So you have a deductible phase, and that can be up to $590. And then again, your maximum out of pocket is $2,000 for the year. It's going to be typically lower than that based on how the plan is set up and how the deductibles are set up. It is way too convoluted to actually go through it in this presentation. If someone wants me to in a private session, I'll sit down with you and review the math and I can show it to you. But after you get to that $2,000, you fall into what's known as catastrophic coverage. And at that point, you don't pay anything for your prescription drugs, and it is covered 100%, and that's through a combination of the carrier, Medicare, and then the drug company rebates that they offer. So to change the page, your Medicare options. This is what I always come to and say, this is the most important page to see here. And we narrow it down to 2 options. I know that seems simple, as confusing as this can be. And within those options, there are other options. But really, what your options are to this point is, option one is you can go on original Medicare, you can purchase a supplement, and you can purchase a standalone prescription drug. And then if you want other extras like vision, dental, and hearing, purchase a separate vision, dental, and hearing. Option two is the Medicare Advantage plans or the Part C. So if you notice, we skipped C when we were talking originally. And they bring the Part A, B, and a prescription drug plan together into a plan. And that's what's done through those carriers that we talked about, that I briefly brushed over earlier. And they add extras in there to entice you to come that way. And they add, and some of them have really good benefits in their dental. Some of them have really good options on the dental side, vision, hearing. Some offer transportation to and from the doctors. They offer these over-the-counter benefits where they'll give you a stipend quarterly towards vitamins, over-the-counter drugs, health medicines, diabetes, things like that. And all of them have a maximum amount of coverage. That's key there. So, let's quickly go over Medicare supplement and how those work. They're also known as Medigap plans. MedSup, Medigap, supplement. They are standardized. I mean, you look at this sheet and how these pay, and it doesn't matter which carrier you purchase your plan from, this pays. So if you buy Plan G from any one of these 20 folks that offer it, then it pays the same no matter which one you go. So here you see there's a Plan A, a Plan G, a Plan N, and a Plan F on this page. Plan F has a star next to it. That is, essentially it's going away. So if you were
diabetes or coronary issues and stuff like that, what does that include?
What do the plans look like, you mean? Well, we're not talking about how those plans are, because I'm just telling you that they're there for this session. But if you and I want to talk in a private session, we can. Yeah. And I can introduce those plans to you. Yeah. So let's turn the page. Well, actually, real quick, before I turn the page, let's go over a quick pros and cons, because I get that question a lot. Why would you go the supplement route versus why would you go the advantage route? And I'll just give a few examples, and at the end of the day, it's really going to come down to you. If you're working with me, I'm going to show you both, and we're gonna do a value analysis. Put together. You tell me everything that's going on with you, and say, okay, well, from what we know, it's roughly going to cost you this much going this way, and or this much going this way. But just some off the top of my head things that I always bring up. So on the supplement side, a reason why you'd start that way. There's a couple that always come up. One is if you are coming into Medicare with poor health, and I'll use the example of cancer, and you know you have treatments that are coming up, and you're going to be in and out of the hospital. Supplement is probably going to be the right way to go, because you're going to have a premium, and then if you're on like the Plan G, you virtually have no other costs beyond that. The other one I like to bring up is if you're retiring. Now let's say you start with a supplement, and then a couple of years down the road, you decide you haven't been using it, and you want to save some money, you want to go to a Medicare Advantage plan. So during that annual enrollment period in October through December, you can make a change. Now, the other way around, let's say you start with a Medicare Advantage plan, and then a few years later, you want to go to a supplement. To go to a supplement, you will be medically underwritten by that supplement provider, so they will check your health history. So to answer your question, if you were on a Medicare Advantage plan, and let's say a few years later, you were to get cancer, they're going to deny you into getting a supplement.
I have a question. Is there a charge? Is there a cost for that? The supplement?
Yeah, supplements have premiums, monthly premiums,
Monthly?
monthly, yeah. Yeah.
I better stay good. I stay working. Don't.
Any other questions?
Really, for real, let your employer pay it.
All right, so this last page, I kind of answered pretty much most of this. When working past age 65, really the most important thing is the late enrollment penalty, but I talked about how you defer Medicare. One thing in here, we'll call it the second paragraph down, enrolling only in Part A. So when you turn 65, again, Part A is free, and let's say you have your employer repel, you are allowed to enroll in Part A, because again, it's free to you, and you can have that as a backup to your employer repel. One thing about Part A, and it's not necessarily Part A, but I mean, I guess it is since that's what you're enrolling in, but once you enroll in Medicare, if you have an HSA, now up to 65, it's fine, but let's say you have an HSA and you're working till you're 67, and then, you're getting ready to retire. They say to stop putting money into your HSA 6 months before you're going to retire. And what it is, when you sign up for Medicare and you're past the age of 65, Medicare backdates Part A 6 months. So essentially, it's like saying you had coverage that 6 months, and the information I have looked up on why they do that, and it's to cover folks in case maybe they missed their window or they forgot. But based on that 6 months, once you are enrolled in Medicare, anything that goes into an HSA would be taxed. Now, let's say you already have a chunk of money that's in there, you can absolutely use that towards your health care afterwards, but you're just, at that point, if you're on Medicare, you're done putting money into the HSA.
Ooh, a lot of information. It's a lot of information. Guys, I hope this has been helpful for you. Like it has been interesting information for me. Hopefully, this kind of give you an insight into Medicare, and to see if you're considering or thinking about retirement,